Nigeria has taken a bold step to place women at the forefront of its health sector leadership. The Nigeria Leadership Journey Immersion program, a joint initiative of the Women in Leadership Advancement Network, WLAN, and WomenLift Health, has launched in Lagos to empower mid-career women professionals through a year-long, fully funded leadership journey. Organizers say the program is designed to offer mentorship, executive coaching, and access to global health leaders, while also creating an international space and an intentional space for women to reflect on their leadership style, amplify their voices, and build networks across disciplines. With women making up over 70% of the country's health workforce, but occupying fewer leadership positions, the initiative aims to close the gap and improve outcomes for families and communities nationwide. The Nigeria Leadership Journey is expected to set a new benchmark for inclusive leadership in the health sector, with participants projected to shape policy, strengthen accountability, and amplify Nigeria's role in global health.
The significance of this event has just demonstrated itself, right? First of all, the opportunity for women leaders to sit with other women leaders who can share their personal journeys. Over the next 3 days, these women are going to have an opportunity to explore very unique leadership frameworks, right? And they're going to have practical examples of how to lead change, right? Within their organizations, across the nation, and also globally. So in terms of the practical experiences, we are hoping that these women, with also their leadership projects, will actually get to the position of leading change within their organizations and demonstrating that they should be leaders that, are called upon when their organizations or even the nation needs things to change within the health ecosystem.
What we envision as WomenLift Health working with WLAN is to be able to be a pipeline of being able to create women leaders that can lead health systems to be able to effect change in our health systems, to build resilient and self-sufficient health systems in Africa. This work is really to help our women leaders to know the capability that they need to take up the spaces, to take up the chairs within those tables and speak up for the needs of the communities that they come from in terms of health outcomes.
So this is an opportunity for women to promote them, to tell them that they can also assume leadership position. I know women are left out when it comes to spaces where lobby takes place at the highest level. Because of our position, you are not there on the table, you don't have the support, and then the network that you have is so limited due to cultural barriers. And most health workers that are women are so dedicated to service delivery. So this also helps us to kind of regain their confidence, to also tell them that they are on track and they can also aspire to be leaders because they have all the talents, they have all the they can also begin to build their own networking and see how they can be properly positioned. Because I strongly believe when women are at the help of affairs of our health sector in Nigeria, we will move forward.
Women leaders are known to focus more on the more cogent things like women's health, children's health, the vulnerable, and using their own lived experience to shape the health sector. And for instance, a nation like Tanzania, where they have strong female leadership, they've been able to crash their maternal mortality by 75%. So I'm hoping that with events like this, we'll be seeing such trajectory in the Nigerian health sector.